Let's talk about high performance testosterone. In our past few videos, we've been talking about the three different types of TRT or testosterone replacement therapy, because when you hear influencers talking about TRT, they're often not talking about the same thing. So far, we've covered steroids and we've talked about true TRT. And today we're going to cover the most complicated of the three types of TRT, what I call TOT or testosterone optimization therapy. Hey there, my name is Dr. Tim Gersmar, and I help middle-aged men to recover their mojo so that they can feel good, look good, perform well, and age healthfully. If you're a middle-aged guy who feels like he's lost his mojo and you would like actionable next steps on what you can do to start getting it back again, let me help you. Just click on the link below this video and I will send you my insights free of BS, hype, and fads, all for free. So please just click on that below. Okay, let's talk about TOT. And this is often what you're going to see influencers talking about when they say the words TRT. So a very quick reminder, true TRT is when a man is problematically deficient in testosterone and then is given testosterone. Now, there are a variety of different forms, which we'll discuss in the future, with the goal of bringing them back to normal testosterone levels via blood tests. Then there are steroids, the use of very high doses of testosterone and often other drugs to bring levels to 3 to 10 times normal to improve athletic performance, appearance, or both. Now we're going to talk about TOT or testosterone optimization therapy. And as I'm defining that here, it is not about restoring testosterone to normal levels. It's about taking testosterone to optimal levels. The elephant in the room, of course, is what does optimal mean? We'll discuss that more in a minute, but let's handle why TOT. Now, I believe there are three main reasons. One is totally legitimate, the other two are choices. The legitimate reason first. Remember how we've talked about normal levels of testosterone in the US are defined from about 3 to 400 to 1,000, but that normal testosterone for any one guy is going to be different from other guys. Some guys may feel fantastic with a level of 3 to 400 or sometimes even a bit lower. Some guys may be suffering with symptoms of low testosterone with normal levels of 5 to 600 or sometimes a little more. And we've discussed how the benefits of true TRT tend to be fairly modest for many guys. Their testosterone goes from 1, 2, or 300, considered low, to 4, 5, or 600, considered normal, but they don't feel any better. Now, we have to say the reason could be because their lifestyle is still trash, or they may very well have other issues going on that are not being taken care of. That could absolutely be the issue. But many doctors who've been prescribing testosterone to real men in the real world have found that restoring testosterone to that normal range isn't sufficient to get many guys feeling well, even when other issues are being taken care of. And that for a chunk of guys out there, it's necessary to get their blood levels to the high end of normal, say 800 to 1,000 or even more. There are docs out there who say that many men need testosterone levels of 1,200 or 1,500, maybe as high as 2,000, which is 2 to 3 times normal, in order to actually feel better and resolve the symptoms of low testosterone. So just like some men will need higher doses of high blood pressure medicine or other medicines in order for them to work properly, some men are going to need higher doses of testosterone. The issue, of course, is that this can quickly devolve into excuses for taking steroids. So it's important that we're working with a knowledgeable doctor, getting monitored regularly, having realistic expectations, and being truthful with ourselves about what's actually going on. Okay, let's move on to discuss the other two reasons for TOT. The first are men who are having mild and creeping symptoms. These are not guys with major debilitating symptoms of low testosterone, severe fatigue, poor performance, weight gain, mood issues, sexual issues, but they are noticing they have persistent, mild, and slowly worsening issues in these areas. It may not reach the level of an actual diagnosis, but the guy is noticing that these symptoms are affecting him and slowly getting worse. Now, before jumping right into testosterone, we have to ask, is that person's diet and lifestyle really in a good space? If not, that is where we should start. And secondly, are other issues going on that are causing these symptoms? Remember, it is not always testosterone. But if both of these things are in a good place, then TOT may be something that that guy considers. Testosterone for a guy like this on a blood test may be at the low end of normal, or it may be normal or close to normal. Now, let me be clear that in this situation, this is not TRT. If you're in this category, many mainstream doctors will not prescribe you testosterone. But there are guys out there in this situation who feel that testosterone has had a major impact on how they feel, how they look, how they perform, and the quality of their life. The other reason for TOT are going to be our high performance guys. These are our category 3 or 4 guys. We've discussed them in previous videos, but these are guys who do not want to slow down as they get older. They want to focus on kicking butt and being the absolute best versions of themselves that they can be. Often they've already dialed in their lifestyle and they have that in place, and they want to take their testosterone to the high end of normal or a little beyond so they can be truly high performance. Again, this is not TRT, but it is a choice that some guys decide to make. So, what are the issues here? First, true TRT is safe. Studies have shown that taking guys from low levels of testosterone back to normal levels do not increase the risk of heart disease, cancer, or other serious issues. If anything, it seems to improve their health. On the other side, we know that steroids are not safe. For many, many reasons, jacking your testosterone way outside of normal is not the recipe for aging healthfully, and I strongly recommend you do not do it. TOT here is in the gray zone. If you're taking TOT, are you putting yourself at risk? The truth is, maybe. We truly don't know. For some guys, TOT can be the difference between suffering with mild or even severe symptoms of low testosterone and living a high quality life. For others, it can be a piece of being the high performance guy that they want to be, and they're happy to do everything that's necessary to do that. And TOT can easily be an excuse to take steroids. After all, we're talking about feeling better, looking better, and performing better. And in the short term, using steroids will do that for you. But we also talk about aging healthfully, and using steroids, especially as a guy who's in their 40s, 50s, or 60s, is not going to do that. Now, having said all this, let's get to today's takeaway. First, TOT is the middle ground between true TRT and using steroids. It's using testosterone to bring your levels to the high end of normal, or maybe above that, to find the optimal level for a guy so that they are feeling great, looking great, and performing well. Secondly, even TOT is not magic. If you don't follow a healthy lifestyle, I believe that TOT is profoundly unhealthy. After all, if you take a sports car engine, you put it in a broken down car, is that going to give you a high performance sports car? No, it's more likely to cause more problems than it helps. Now, TOT is not true TRT, and most mainstream doctors will not support you in using testosterone in this way. So when should you consider TOT? Well, first, if you are following a healthy diet and lifestyle, what I call the foundational health habits, and you're on TRT, but it's just not working, you're still suffering with symptoms, then you might need a higher dose, and TOT may be right for you. Second, you're following a healthy diet and lifestyle, you've taken care of any other issues that might be causing these creeping low-grade symptoms, and you're fully informed of the risks and costs of testosterone therapy, then TOT might be right for you. Third, same as above, healthy lifestyle, other issues taken care of, and you're in that category 3 high performance or 4 biohacker category, you're informed and you want to take things to that next level, then TOT might be a good choice for you. So the next time you hear an influencer talking about TRT, you now have the framework and understanding to recognize, are they talking about true TRT, TOT, or steroids? And you're better able to sort out good information from bad. In the future, we will continue breaking down myths, fads, BS, and bad information out there so that you can focus on doing the things that are truly going to help you to feel better, look better, perform well, and age healthfully as a middle-aged man. I hope that you will join me. Just as a reminder, if you'd like genuinely useful health insights, please click on the link below. All right, guys, until next time, take care.